Tracking clinical quality measures is often seen as a necessary but cumbersome part of participating in value-based healthcare. But some practices are using tools available to them to alleviate that burden and drive improved patient care. One of those practices is MMR Healthcare here in Boynton Beach, Florida. And speaking with me today is Dr. Martha Rodriguez, CEO and President of MMR Healthcare. Dr. Rodriguez, thanks so much for your time. Now, HEDIS is a standardized measure set. It's used by about 90% of the payers out there. Are you participating in any contracts that look at HEDIS, and which of your payers are participating?
Yeah, we use HEDIS in our practice a lot because we have managed care contracts. And ever since the concept came out, we've been following it and using it a lot. It's always been very difficult, but we've managed to maintain a 5-star score since the HEDIS module came out. 5 stars, of course, being that top level everybody's shooting for. And of course, there are some nice incentives to get there. But what were your challenges with participating in HEDIS before you got the module from eClinicalWorks? Honestly, it was the nightmare of my life because we were inundated with lists from the insurance companies. Every day we would get a new list. These patients are missing eye exams. These patients are missing mammograms. Go back to a staff member, order the charts, then give another list. Sometimes my knees will shake when I have to give another list of patients didn't have a colon test. It was every day a new list, always working backwards, always depending on data, 90, 120 days different, old. Now all of that is gone.
Is there a diagnosis code for physician anxiety for HEDIS measures?
Burnout is a frequent diagnosis code. They're all burning out.
Well, we're here, of course, speaking with you because you're using the HEDIS dashboards to reduce that burnout, and we'd like to get a little bit details of why. So let's talk about how the eClinicalWorks HEDIS dashboard and tools that are available are helping to make that less of a challenge for you.
Oh my God, I'm so excited about this HEDIS dashboard and this HEDIS module because really it's incredible. To be able to know when you're seeing a patient what measures are missing is so incredible and transforming that I cannot describe it. It has also helped me to modify the way we document. Because for instance, even though the HEDIS dashboard is so helpful, it depends on everybody making the information appear there. So with the use of the dashboard and the HEDIS module, I was able to create template to collect data in a way that it never, ever had to go back and be reviewed again. We will know when we see the patient what's done, what's not done, and what's left.
No more guesswork about whether this gap is open, closed yet, things like that. Now, you were talking about getting daily reports from your payers, and I know many offices will also get a monthly visit from a payer representative to help them keep track of care gaps and show them where they need to do work. Now, this is obviously something that takes a lot of time out of their day when they could be dedicating that to patients. How is the HEDIS dashboard helping you to see those care gaps? Where are those showing up? Is that only in the dashboard? Is it at the point of care? What tools are available for you?
No, both. We have the population health on the right side panel that tells us at the point of care what the patient is missing. And then we have the dashboard to follow it so that we can catch it before it goes away from us. But most importantly, by using the data, for instance, there's a measure that is very difficult, and that's the diabetes measure. And in the Medicare Lives portion of that, if you fail one portion of those measures, you fail the whole measure and you lose the payment. Example, if a patient has a controlled blood sugar but hasn't had an eye exam, doesn't take a statin or takes a statin and takes an ACE inhibitor, which is a medication, so one of them is not correct, you lose the whole measure, which is a huge loss in income. Using the population health module, I created a template that when we see a diabetic patient, we have a section that tells us to complete each portion of that diabetes measure in one shot at the point of seeing the patient, and we've never had a problem again.
And you haven't had to log out and check a report or go to a payer site or even go to that other dashboard page in eCW. Now, you work here obviously with other providers. What has their reaction been to having the care gaps in that right panel for them?
They love it. They love it because they don't get yelled at so much. Because, you know, it's frustrating when you have to keep going back and doing work. And you cannot always depend. We have so much to do and so much documentation to do. Doing it once is more than enough. So they have really embraced it because they know when they collect the data, it's done. When they see the patient the next time, it tells you it's so nice to see all the measures completed. That's amazing. So they're very embracing to the tool.
Green lights all the way is what we
Yes.
want to see, right? Now, version 11 also adds an integration with the messenger tools that are available in eClinicalWorks. How is this helping with your outreach and improvement of patient care?
So we use the messenger to let patients know when they're missing a measure. For instance, we let them know if to call our office and schedule a mammogram, or to call our office for a flu shot. We have flu clinics, and we send messages to tell them to get their flu shot or their pneumonia shot, or to check their blood sugar. Whenever we need, we just create campaigns based on that.
Excellent. So it must save a lot of staff time then.
Oh my God, tremendous. And it ties the patient to the practice in so many ways. That's just one example of what reaching out to patients brings back to the healthcare system.
You mentioned that your office had achieved a 5-star rating on some of your HEDIS measures. What role did the HEDIS dashboard play in achieving that 5-star status?
Well, since the HEDIS model came out, we had 5 stars. When the practice grew and we were unable to collect the data the way that we're collecting it now, 1 year we lost the 5 stars. I almost died because I don't like that. Well, we got the tool and we went right back up to 5 stars because we were able to collect the data the way that we couldn't do it before. It's just too hard. There's no way to do it. It's too many measures, too many people involved, too much staff time that it gets done one time in the tool and that's it.
So it sounds like what you were saying is prior to your office expanding, it might have been manageable, even though difficult, to stay on top of those HEDIS measures. But then when your office grew, it became harder to know what was going on and make sure everyone was doing the same thing. So you were able to increase your visibility into what was going on in your practice and make sure that everybody got on the same page to bring those HEDIS measures back up to 5-star rating.
Yeah, and the thing is that we depend on data that's old. If we don't use the tool, the only data we have available is old data. So if they give us a list in December of a patient that hasn't had an eye exam and it's the end of December, what useful is that? We lose the stars. Now with the tool, nothing escapes us because we have the information at the point that we need it.
And it's integrated with all of the clinical information that you're gathering right there in your practice.
Correct.
Excellent. Well, Dr. Rodriguez, thank you so much for your time here today. If you'd like to know more about the HEDIS tools that are available from eClinicalWorks, check out my.eclinicalworks.com or speak with your strategic account manager. And don't forget to check out our other podcast episodes on iTunes, YouTube, or my.eclinicalworks.com. For the eClinicalWorks podcast, I'm Adam Salati. Thanks for watching.